Delighted to welcome all of you here. I'm Diane Kresh, and it's a privilege to host today's release of the 2019 Community Reports for both Destination 2027 and the Arlington Partnership for Youth, Children, and Families. It's a real privilege to be a part of that. Arlington Public Library is the heart of our inclusive and dynamic community, and our librarians are committed to their roles as trusted advisors in responding to the needs of our patrons. The library provides resources and services ranging from digital database subscriptions to electronic and physical books. We host fitness classes and nutrition workshops, and we have a team of experts ready to answer your questions and refer you to appropriate resources free of charge. Just as the library is about more than books, health is about more than healthcare. And increasingly, the library finds itself emerging as a safe place to discuss openly the challenging issues we face as a community. Last fall, APL partnered with DHS to co-sponsor an event with journalist Beth Macy, author of Dope Sick, a book about the national opioid crisis from which no community, including ours, has been immune. That evening, Macy spoke about those on the front lines of the crisis: doctors, ambulance workers, addicts, bereaved mothers, all of whom are dealing with a crisis that is both merciless and senseless. Attendees felt safe, responding with stories of their own. When Arlington consistently rises to the top of best places to ... lists, it's sometimes easy to forget that there are people in this community who are hurting, who do not have the resources they need to lead productive, healthy lives, whose well-being is negatively affected by the choices and decisions, however well-intentioned, others make. Health issues manifest in disparate ways, and barriers to access of quality care are affected by our residents' nutrition, employment and education level, skill in navigating social services, and inefficient communication between healthcare providers. In Arlington County, healthcare status closely follows economic status, with a wide disparity between and within zip codes. Thanks to Destination 2027 and our partners around this room, more of our neighbors receive quality care, making us Virginia's second healthiest county. But inequities continue. Our work is not done. The work of the task group has had a significant impact on the Department of Libraries. We have used the language, expand access to the resources and opportunities needed for optimal health and well-being as a call to action, using it to drive our priorities towards identifying the needs of those most at risk. As a first step, we have chosen to focus on the residents and neighborhoods along Columbia Pike, and will host a series of meetings to assess whether the programs and services we offer are the right ones. And we have taken to heart that a healthy community depends on high rates of literacy, and that reading for pleasure improves personal well-being. Literacy and reading for pleasure are two of the most important elements of our mission. As an institution focused on evaluating and disseminating quality information to our multicultural, multilingual, and evolving community, Arlington Public Library has a unique role to play in creating a healthy Arlington. As a collaborator with all of you, we pledge to provide our residents with the tools they need to make healthy choices. We look forward to working with you and within our community so that every Arlington resident has a chance not only to survive, but to thrive. And now it gives me great pleasure to introduce my friend and colleague, Anita Friedman, Director of the Department of Human Services.
Thank you, Diane, and thanks to everyone for coming out for this very special presentation. Want to recognize everyone who works for our county, as well as our commissions and citizen groups and community members. We have a special presentation today that involves two seminal reports. One is the culmination of over a year's worth of work on planning for the next 10 years for what a healthy Arlington will look like in the year 2027. And our project was Destination 2027, and you'll be hearing more from Dr. Varghese and the co-chairs, Tricia Rogers and Abby Raphael, about what that was entailed. And we also are presenting to you today the community report from the Arlington Partnership for Children, Youth, and Families, which has been around for a long time and has had an important role in providing data about the health and well-being of our children and families to Arlington so that we could make informed decisions about what are the practices we need to have in our community to improve the overall well-being of our community. But the common thread between these two reports is equity. And as Diane so eloquently elaborated, this is a tale of two cities. This is a tale of Arlington folks who have, and then Arlington folks who don't have. And what you'll learn through this very sort of stark reality is that there is a decade of difference in life expectancy, which is the ultimate outcome of health, between certain parts of Arlington and others. That means there's 10 years less of family get-togethers, celebrations, picnics, time spent with children and parents and loved ones. And this group has valiantly determined that this equity exists and it is not okay, and we need to do something about it. And they brought together a broad swath of stakeholders in the community to start looking at what we can do, and you'll hear more about that. It's important that one of the central themes that they'll focus on today is what is equity and what is equity versus equality? You know, all men are created equal is what we always say in this country. And you'll see very, very simply but very keenly put in that bicycle depiction, we are used to giving everybody one of the same thing. One size fits all. You get to take out, you know, one of these things from the library, one book, let's just say. You need one chicken in your pot, right? We think of an equal distribution amongst everyone as the right way to proceed. We've always been trained that way. But actually, that's kind of a false premise, because what equality is looking at is, well, everyone needs the same thing and starts from the same place, which is not the case. That's not the case. We all start from different places, and we all have different needs and abilities. And therefore, equity is looking at what are the particular needs, abilities, circumstances, experiences, knowledge of the different subpopulations who we work with in this community. So as you can see, as opposed to one bike that's the same for everyone, in the equity picture, you have a bicycle that fits the needs and abilities of the individuals who will actually ride those. So, not to take away from the very important statements that will be coming, let me say that I will be handing it over now to Tricia Rogers, co-chair of Destination 2027 Steering Committee, and Sheila Fleischacker, chair of the Arlington Partnership for Children, Youth, and Families Foundation Board. Take it away.
Thank you, Anita, for that introduction. And I would like to introduce the two experts who are on the stage with me. To my immediate left is Kim Durand, who is the coordinator of the Arlington Partnership for Children, Youth, and Family. And to her left is Dr. Varghese, who is the Public Health Director here in Arlington. And I'd like to start, Dr. Varghese, by asking you a couple of questions. Can you tell us a little bit about Destination 2027, what it is, what the process is? And then I have a follow-up question for you, too.
Sure, great question.
Can we pause for just a second? I'm sorry, because I know, but we need to figure out.
Apparently.
We are on Facebook Live, and we're very excited about that. We want everybody to be able to hear us.
Okay.
Do you need to turn on? Is that the
Is
deal?
that the problem? Okay. Turn it on.
Can you hear me now?
Can you hear me now? So.
I'm sure you could hear us before, but now everybody online can also hear us. Yeah, it's going to be on.
Yeah, where?
Sorry.
Hold that. That's okay.
Right here? This button. Hold it down.
Hold it.
There we go.
Technology's great, except when it isn't.
Well, the audience now really knows it's live. So.
Okay, so the question, Ruben, if you give us just a little bit of background about Destination 2027, the process, why you brought the community together to...
Right. Just to repeat to folks, we're part of the Virginia Department of Health, and one of the requirements, a structural requirement, is to actually do community health needs assessments. And remember that word structural. We have to be intentional about these things. And we have done this once before, and we call that Destination 2017. And at that time, we made an assessment that this community was healthy with the available data that we had. And it was an assessment that the Robert Wood Johnson Foundation, a few years later in 2011, has, for the next 8 years, has proven that we're in the top 3, as Diane Kresh mentioned, 1, 2, or 3 in each of those years for overall community health. So, you know, that's a wonderful thing, and yet there have been anecdotes and the evidence that we see regularly, that was aggregate data, and we needed to move towards disaggregate data. And the Northern Virginia Health Foundation really provided the key for this next effort when they provided disaggregated data for the region, and you discover that although they did confirm we had overall good health, the fact that there's a decade of difference in life expectancy. So if you see the image over here, and I will walk to it, they knew this was going to happen. Imagine that there's a difference, 88 years in life expectancy for North Roslyn and 78 for Buckingham. And Kurt's going to raise that. So, you know, 10 years life difference. So you have fewer picnics, family gatherings, high school graduations. Thank you, Kurt. I have to tell you that as a healthcare provider or as a doctor for this community, that struck me. I would conclude exactly what this community did through the steering committee process, that disparities exist, they matter, they are not okay. And I had the sneaking suspicion that this community would agree as well. And that's really how this process started. And we launched the next phase of the community health assessment, but with the challenge of let's look at it differently, because there are populations that are not thriving in Arlington. And that's not who we've said we want to be. Let's live up to who we want to be.
So you're saying that that disaggregated or that aggregated data masks some of the disparities?
Correct. We have to start recognizing that averages are helpful, and we need to look to make sure that, in fact, everyone has that same experience. So for those of you in the audience and those here, I'd like to see one color of life expectancy, all green in that map. So sometimes we want it to be uniform. I want uniform thriving for everyone, and I think everyone here wants our populations in Arlington, everyone to experience that sort of thriving.
Thank you. Kim, can you talk a little bit about the partnerships report?
Sure. So we are celebrating our 20th anniversary, so we're very excited about the partnership having been started in 1999. And over that course of time, we've actually done 5 different community reports. And our reports work very closely with Arlington Public Schools and our partners there. We survey students in grades 6, 8, 10, and 12. We do 2 different surveys. One's called the Youth Risk Behavior Survey, and we also now have started doing something called the Your Voice Matters survey. And so the bulk of our data comes from those surveys. But in our community report, we really try to pull together a variety of different data. So we work very closely with housing, with the police on arrest data. We work with APS for graduation data. We work with a wide number of our nonprofits in housing and food insecurities and things like that. So we really are trying to get a picture of what Arlington looks like right now, and then thinking about the different communities within Arlington, what can we do about that data? So we're excited to be rolling this out with Destination 2027, and I think that's all I'll say right now.
Well, both of your reports suggest that Arlington needs to do business in a slightly different way. And can you talk about sort of the lens that you used in developing your reports?
I'll be happy to start. So as Anita Friedman talked about the bicycle image and have people take a look at that, we're really trying to shift our decision making in the government, for-profit and nonprofit sectors from an equality lens to the equity lens. So just as a reminder, pretend the purpose of our policy is to ride a bicycle to good or optimal health and well-being. So if that's the purpose of our policies, the equality one, and those are 4 different populations of purple people, okay? Only one of those purple people can actually ride that bicycle comfortably to optimal health and well-being. 2 of them could actually get injured on the way to that goal. That doesn't seem to be the right thing if our goal is optimal health, and 1 can't participate at all. That's the one size fits all. So if we can start shifting our public policy decisions, and when I say public, it's group decisions, government, for-profit, nonprofit sectors, to an equity perspective where let's look at the needs of the various populations. If our objective is optimal health and well-being, let's make sure that they have the resources to get to that goal. Let's not only have good intention, let's also have good impact.
And so some of the ways that that's playing out in our world is, for example, in the Your Voice Matters survey, which really was a joint collaboration between schools and us to be able to develop this new survey, where we can disaggregate that data by school, but also by gender, by race, ethnicity, by a 504 plan, by English spoken at home. So there's so many different ways that you can look at this new data. And so we're looking forward to seeing, because what works at one school might not work at another school, or what works at one community or within one rec center or one library might not be that one size fits all. And so we're looking forward to going out into the various communities to talk about the data that they're seeing in their communities and what is the appropriate response. So being able to break it down like this is very exciting to us.
Thank you. Would you mind expanding a little bit? You talked about the Destination 2027 bringing together a steering committee, and you guys focused in on health equity. Can you talk a little bit about the consensus building process that went into focusing on health equity? And also, can you operationalize a little bit more what health equity is besides a bike example?
We'll try our best here. So first of all, when we do community health processes in public health, we try to bring as broad a coalition of people to the table. What people have to realize is more disciplines deal with health than they're aware of. So most of health is not in the hands of the public health department or doctors or nurses or the hospital system. So both in 2007 and in 2018, we brought together a diverse group of stakeholders from many of the different sectors, and you'll even see it on the back of a report, with perspectives on housing, the education system, healthcare, neighborhoods, that sort of concept. Let's get different players to the table to realize, let's share that information. We had made the assessment that there's a decade of difference based on this data. But we in public health, we're not going to have, as the division, the solutions to how it was created here in Arlington. So we brought together people from different organizations to share this information. So my assessment may have been disparities exist, they matter, they're not okay. However, we need that coalition to come to the same conclusion. And by having monthly meetings, showing them data, getting their input, asking the people in this room and others, does this really matter? Do you agree with our assessment? Because it really needs to become our assessment, not just my assessment. And that was the process, in a sense, in a short form, of how we got to this point and this report. Now, the larger question, is there a different way to look at this? So going back to the life expectancy map. So that's the health outcome. When you look at the community conditions, similarly to the economy, education, environment, you will see one of the graphics is about childhood poverty. We have certain census tracts in Arlington that have a much higher rate of childhood poverty than others. And yet our reputation is that we have very low rates of childhood poverty for the whole county, and especially in comparison to the rest of Virginia. So it's a tale of two cities, a tale of two counties actually, and we need to be able to start looking at that, because the experience of those children in the areas of poverty or higher poverty versus others, they're going to have different health opportunities. And we need to figure out, confirm that suspicion. So we're not done yet. We need to find out, as Kim was saying, you go talk to those communities. So activities like Community Progress Network, where they bring people to the table, are the types of activities we need to see what the lived experience in certain of the more disenfranchised populations or geographic centers, so that we learn what their true experience is and what are their opportunities for health. That's how we put equity into action. We find out the real experience, and if it's true, how do we start improving their choice of opportunities? One opportunity is not choice. Other neighborhoods have several. Let's give everyone the same opportunities in one sense that meet their needs.
Can I ask him a follow-up question? Is there a definition for health equity that you have?
Sure. We will unpack the term health equity. I use the word health equity because as the health director, well, I'm not going to talk about broad equity. I put the word health in it, but let's work backwards. So what is equity? It goes back to this definition here. Equity would exist when everyone has access to the community conditions needed for optimal health and well-being, okay? We have to realize the results of the things you do in your work, whether you're in the economic sector, the education sector, the environment sector, healthcare, housing, neighborhood, or social connections. Your policy decisions there, how we make decisions, have impacts on people's health. And there are biases there. And so we're trying to start recognizing how do we reduce those biases and change our policies so that we have better outcomes. So health was put in front of it, but really it's a symptom of the inequities. Phrased a different way, inequities are making us ill. And we need to stop that because it's in our control. We as people together can make this work.
Thank you. Kim, do you want to expand a little bit about the partnerships equity approach to, besides disaggregating the data, other approaches that we've used to operationalize it?
So there's so much there. So the 2014, so in 2014, which was when we put out our last report, is when as a partnership we really wanted to focus more on how do we pull out different pieces of our data. And so at that time we were looking a little bit more at childhood obesity and some of the housing and food instability were really starting to bubble up. And then, as I forget if it was Ruben or Anita mentioned about the masking of the disparities, because we have these wonderful averages. And so we really did start to pull it out. And as we were preparing for this report card, we really were looking for data sources and trying to dig into what does that look like for the different communities that we work with. And then another thought that I had about how we're operationalizing all of this is really about the collaboration and coordination. And I think that this kind of an activity really demonstrates that, because we, Sheila and I, went to the Destination 2027. We did not work in a vacuum on either side. We've worked with CPN, we work with a lot of different initiatives, the Child Care Initiative, the Bridges Out of Poverty, Destination 2027, so that we really are trying to bring everybody together so that we are coordinating our efforts and, when possible, collaborating to create new ideas and opportunities. And then how we institutionalize that, I think we're still figuring out, but we're excited for that.
Just want to piggyback on that. One of the things that we have to realize, a number of the groups that we brought to the table, we all share often the same clients, the same at-risk individuals. So there is value in continuing the things we each do individually and asking the larger question, how can we serve the vulnerable populations that we all serve better so that more people are better off and we can work together further upstream in our policy making?
Both of you have just touched on some of the disparities that are lifted up in your report. Obviously, life expectancy is the ultimate health outcome. But Ruben, can you start by talking about some of the other disparities that are in the report?
And I'm going to make reference to our report, our beautiful report that staff helped to create, page 6. So as Tricia reminded us, life expectancy in my mind is the ultimate health outcome. I suspect all of you will have that same assessment. So in addition to that, for example, I'm going to mention 2 other health outcomes: asthma, illness, and the rates of hospitalization. Arlington does very well when you compare ourselves to hospitalization in Northern Virginia for the number of Arlingtonians getting hospitalized for asthma. We have half the rate of Northern Virginia. But when you disaggregate and look further, we have an 8-fold higher rate among our Black African American residents compared to white residents. We need to understand why. We haven't been able to do that yet, but that's one of the first things you find out. Why should that be? Secondly, mental health, and I know this is an important issue for our community, and I know it shows up in your report as well. Mental health among adults, the number of adults or percentage reporting 8 or more poor mental health days a month. We rank very well. We're at the very bottom in a sense. We don't have as many people reporting poor mental health days. Yay, that's actually a good thing in aggregate. But when you look at the disaggregated data among people who make $50,000 or less versus those who make more, 2-fold higher rate reporting poor mental health days. So that's outcomes. The same thing for community conditions. The children living in poverty, for example. We're the 3rd best. We have the fewest number of kids living in poverty. We should be very happy about that. And the dark side of it is there are certain neighborhoods where it's 5 times higher in certain neighborhoods than others. What's the health impact of that for those children and their families? How do we make sure they have the same health opportunities, or the opportunities to get to optimal health and well-being? And health insurance coverage. 10% uncovered in health here. Doesn't sound like a lot. And in Virginia, that is a very small number. But that's still about 22,000 people. And then within that, the disparities there among Hispanic residents versus non-Hispanic residents, it's an 11 times the rate.
So it's not just socioeconomic status, it's race, ethnicity. Are there other populations that are particularly burdened?
Sure. In general, the populations who are typically burdened will be women, people of color, the LGBTQ community, those who are disabled, income, and then by geography. Now, often the geography is because of the intersection of all of those groups living in certain places because of our policies.
Kim, what are some of the disparities that your report revealed?
So first, I forgot to mention on your chairs, on most of your chairs, there is something called the Community Report and Introduction. And this is our sort of executive summary for everybody to have. We also have our full community report. We do have some copies for folks if you're interested in a full report, but if you like it, it is also available online. So in our full report and thinking about where the big disparities are, you really touched on it. For us, it's really the concern about the youth mental health. And on page 36 and page 38, if you had one of these in front of you, you can see actually all of these little tabs are where I've been highlighting where we've got some big disparities that we're talking about. But the mental health one is really of concern for our youth of color because there's, all of our youth are having some difficulties around mental health issues. But if you look at page 36, if I can find it quickly, what we see is that one of the indicators is feeling sad or hopeless, and this is 36% of our Asian students, 28% of our Black students, 37% of our Hispanic students, and 23% of our white students are feeling sad or hopeless in the past year, in the past 2 weeks. So those are all startling numbers. So even when you add them all together, and even if you could make disparities be hidden and masked, it's still not a great number. And so, but by pulling those numbers out, each of those populations, there will be something different that we can do for those students, something different that our school counselors can look out for, something different that our community centers might be able to do, or the folks that we work with. So, so we're really paying attention to that, and also along with that are the LGBTQ students, and that's on page 38. And so we're really looking at that and working very closely with our partners on what some of the different opportunities might be.
I had just one follow-up question. Ruben, you talked a little bit about where people live. Are there other community conditions that can affect health that most lay people wouldn't think of?
Sure. When we're talking about community conditions, it's what people are surrounded by, and the way we talk about it in public health is, once again, the community conditions that are listed on the back page of our report. And so economic conditions, what are people living with economically? What sort of educational environment or opportunities do they have in their environment? The actual physical environment, green space, air quality, those sorts of things. Healthcare, I've already mentioned. The quality of their housing, crowded conditions, lead paint, those sorts of things. Neighborhood structure, the built environment, sidewalks, green spaces there, and social connectedness. People forget about that we are not just solely individuals. We are social creatures. We need to feel connected, and the more connected we feel, we'll have better mental health, social health, and physical health. So those are all factors that we need to consider. There are different ways of slicing and dicing this. The important thing is we have to think more holistically, and that there's a lot more intersectionality.
Is there anything in your report, Kim? I know that I was struck by the food insecurity and how that can have certainly an impact on academic achievement if a child's hungry.
Right. And yeah, there's so many different things and so many different intersections. And actually, we were talking with somebody earlier today about some of the different things and the different questions that we have. There's so many different ways that we could have presented any of the one data points in our report. So what we're really looking forward to is engaging more, getting more questions from the community, and digging in a little bit deeper on some of the different points so that we can get to some of the deep dive in and mine the data in a better way so that we can answer some of those questions.
Could you expand on some other next steps the partnership's planning, and same with Destination 2027?
So our three words are research, engage, and advocate. And the research, really this is the culmination of some of our research. Now we're excited to do the engagement, and we really want to get out into the community and talk with folks about this data and really find out what are their concerns, what makes them go, oh, I wonder what this means. And so that we can start to think about it in a deeper way. And then from that engagement and gathering more data, then we are in a place where we can build our advocacy plan, because it's a community-led organization with our chairs, Sheila, and our incoming vice chair, Bart. They can do some advocacy to the school board and the county board based on what we're hearing from the community. So it really is so important for us to be out where people are. We used to use a model of bringing people to us, but I think we're really looking forward to going where people are now. And so if you have a meeting or a group that is interested in this, please invite us. I'm throwing Rebecca Helm into the ring with me and the rest of my team. We are excited to go out and meet with people. We meet with the teens on a regular basis to talk about this data as well, because what better group of people to talk about, why are you feeling depressed? Well, we can all sit up here and wonder, why are they depressed? Or we could actually talk with them and find out what's going on in their lives. So we want to make sure that we're going out into the community to talk to folks.
Thanks. And Ruben?
Sure. So I'm going to refer to the second to last page of the brochure and cueing the folks at the camera level. There are a couple of things that came out of the steering committee, and I want to make sure that the recommendations, first of all, are noted, because they really are some of the next steps. So first of all, the steering committee concluded that in 2019, the county board adopts a health equity policy. And government has a very large role in stimulating these sorts of activities and trying to change the perspective we're building. And within that policy, there are 4 pillars that I want to make sure, as I do 4 pillars to achieve health equity. First of all is making sure that people have access to the disaggregated data and continue to disaggregate to a certain level. We don't need to go to such granularity by person. What are the general trends? How do we start making disaggregated data like this available to decision makers? The next step is building awareness. So in a sense, today we've shared with you data and we're building awareness. That needs to continue throughout this process and expand the circles of people who are aware that disparities exist. Because they can make better decisions, hopefully, once they know the impacts of their policies. The third pillar, embrace a culture of collaboration and coordination. We don't always need new resources. We know that that we have the resources at the table. How do we coordinate those and collaborate so we can make the best use of that? And finally, the goal is really to expand access to opportunities for those who are vulnerable and the resources. So we have to remember those are the goals that are happening here. And finally, to do all of that, so we said the policies and the pillars, we need to make sure that there's an accountability mechanism. And so we're also recommending that the county establish an entity, either within or outside of county government, to implement this policy. And to make all of this happen in the short term, we're going to have a implementation task force to get the policy finalized to send to a board for consideration and making recommendations of what an entity would actually look like, what are the pros and cons of the different ways of doing things.
We want to open this up to your questions, but one final question for both of you. We have a lot of community members in the audience here. How can the community get involved in advancing the work that both of you are doing?
Well, I like that one of the pillars talks about that awareness, because I think that that's where you all really do come into play, is helping raise the awareness and making sure that the entire community has an opportunity to buy in and participate fully and really engage with the data in a way that they might not have. I mean, I never thought I was a data person, but this really is exciting to think about all of the different things that we can do with this information, but it doesn't do any good. I mean, these reports are awfully pretty, but they don't do any good if we're not using them and raising some awareness and information and using them to make change.
And likewise, I think this is really, we want to turn this into action. This is not a static report. And so on the back it says equity in action. There are 4 questions that any of you in the community can ask for yourselves or your organizations. Who benefits? This is disaggregating the data, asking those questions. Who is burdened? Who is missing? And the reminder, how do you know? Stop making it a thought experiment. Go talk to real people and find out how this impacts people. And then keep doing it. If you adopt a policy, did it confirm those things? If it didn't, you need to go back because we shouldn't be leaving anyone behind. We want everyone to thrive. That should be the goal. We want everyone to get to optimal health and well-being.
Thank you. And then we want everybody to fill out the census too.
And
your voice matters.
And why is that important?
Basically, the data that populates the partnership report and the Destination 2027 report, the vast majority comes from census data, collecting things like race and ethnicity information, other socioeconomic demographic factors. Without that data, we will not be able to see who is disenfranchised. The perspective will always be everyone is enfranchised, and we know that is not the reality. So that is why every census matters, and I'm so pleased that our county is being aggressive on this to collect the data and get people enfranchised, at least in Arlington. Spread the word. If you don't live in Arlington, make sure you get census done for everyone.
And with that, I would like to introduce my co-chair, who is not a stranger to most of you in the room, former school board chair, Abby Raphael.
Well, thank you. Thank you very much. We are going to have time for a few questions, so if you have a question, please come on up to the microphone. And while you are doing that, I would like to recognize the leadership of this group of folks in achieving health equity in Arlington. So to Sheila and Tricia and Kim and Ruben, thank you so much for leading these efforts. Let's give them a round of applause. And as Ruben mentioned, collaboration is such an important part of achieving health equity and really in anything that we're going to do in any community to be successful. And these two reports were the result of tremendous collaboration among Arlington County government, Arlington Public Schools, the nonprofit sector, and lots of citizens. And many of you who worked on these reports are here today. So if you work in any way with a partnership for children, youth, and families, will you please stand up?
Woo! That's you too.
Woo! Right. And those of you who participated in Destination 2027 in any way, please stand up and be recognized. Well, thank you all, and that's a lot of the room, and many of you worked on both groups, so that's fantastic. Thank you so much. All right, now, this is not a shy group, I am sure, so please come on up and let's hear what you want to learn more about. Go right ahead.
Hi, my name is Anne-Marie Douglas. I serve on the School Health Advisory Board, and I have the pleasure of working with a lot of you and looking at the data. We just started a subcommittee on screen use, and not just in schools, but at home. And I've been following the APA, the AAO, the AP, all the different acronyms. It's their own language. But our teens said they spend approximately 10 hours on screen per day. The NIH study that just came out on 11,000 kids showed the brain effects of screen use. The American Psychological Association has a longitudinal study from the 1990s on 1 million teens and show when the critical mass of us got a smartphone, there was a spike in depression and suicide attempts. Looking at not only that, but the other things that are hitting the fan right now in the way of the epidemic of myopia, the effects of blue light and near screen on the retina, which could lead to age-related macular degeneration. Things are coming out of the woodwork like they have with every new technological advance that humans have ever come upon, like DDT, anything. We make a discovery, we find out the perks, and then we find out the detriment. And that pattern shows across like hundreds and hundreds of years of what we do as humans. We are a curious group. So when I look at this equity and equality thing, I do think about handing everyone an iPad. And we look at that, I would think that would fit in the equality part, whereas the equity part would be looking at each individual child. And for some children that I know quite well, an iPad is not good for them, for their eyesight or for the eye doctor's recommendation. So I would like to just keep this in the forefront as we move forward together as a community, to keep that in mind. And
maybe if I can put to the panel, any thoughts on technology and equity?
Well, I just know the work that Anne Marie is working on, and I know she's working with so many people, so the School Health Advisory Board and the I've been involved with some of those meetings and with also the Healthy Community Action Team, HCAT. They've got some work around this, so if anybody is interested in helping to make sure that Arlington is focused on this in a meaningful way, please let us know, because we are really trying to get some efforts towards this to find out more, to educate ourselves, to make sure that we're spreading the word about not just, technology isn't all bad, but what is the appropriateness of it, and what are we doing, what chances are we taking by not being aware of those things. So I want to say thank you to Anne Marie, because she really does bring this up, and we want to pay attention to it and figure out how we can appropriately manage it.
Yeah, I mean, I would echo Kim. I think we're very grateful for Anne Marie, both in forums like this and on the social media, of kind of raising awareness. And I think, again, to Ruben's push of us thinking through all the policies, whether it's the one-to-one policy, of thinking through that full spectrum. I think we're new to this in our county government right now, but I think these are examples and how we might operationalize it. We don't know, we're still learning how to actually do this, but I think, again, that's a good case example where we can start thinking, is it actually equity, or is it equality, and how is it impacting all our kids?
Any other questions or comments from the audience? What a quiet group. Is this Arlington? Well, I have a question. Equity and health equity clearly is such an important goal. What are some of the obstacles in Arlington? Why does it seem like we have so far to go, and we're looking at 2027 before we're hoping to achieve it?
Can I?
I think you should.
The community members.
Please.
Well, I think one of the obstacles is that people have not been aware of the disparities. And until the data became available, we did believe that we were number 1, 2, 3, whatever, in so many different metrics. And that's not the case. And so to me, at least, raising awareness is foundational. If you don't know there's a problem, you're not going to do anything about it.
The other part of it is reminding people that health is not just about the individual actions we take. So 50% of our health is determined by what society has come up with. We need to be aware of that, and that is another thing that's really hard for people to think about, that our actions as a society have as much impact on our health as our own actions. And so that's another awareness that we need to embrace, and that we can solve this. We may not have created it, however, we can all solve this.
And if I don't lose my thought, I think it's also, we need to step outside of our comfort zone a little bit, because it's so easy to do things the way we've always done them. And I think that we need to stretch ourselves a little bit and really think beyond the way we've always done things, because the way we've always done things is not always going to get us to the results that we want now. We can't continue to do things the way we've always done them and expect to be able to do these things. So it's going to be hard. We need to really think about how are we going to do things differently to get to these new results, and that's not easy work.
Thank you. All right, we'll have one quick more question. Thank you.
And so as part of the Destination 2027, I always brought up this question, and I'll bring it up again. If I live in one of those green areas, how do you make me care about the yellow and the red area?
I'll take a stab at that. I actually, first of all, have this fundamental belief that people want to help each other. And I think Arlington has been a community where that has been shown to be the case. Now, it doesn't mean that we can solve everything overnight. We're only able to solve the things we become aware of. We've had a tradition, though, also of working on things. So when you know that we've tackled things like the 10-year plan to end homelessness here in Arlington, the child care initiative, trying to deal with the achievement gap in Arlington Public Schools, there is an ethic here to help our neighbors. When we responded after 9/11 to being attacked, we pulled together. So I think, value resilience, and I think people realize that we are more than the sum of our parts. And so people matter here, populations matter. We need to build on that energy and keep people, letting people know that the health of other people impacts our health as a community. We are only as strong as our weakest link. Let's make sure we're as resilient as possible. And I think, Andrea, that's the way that we need to remind people of their self-interest. Health, just like communicable disease, you want everyone else to be vaccinated to make sure that those who can't be vaccinated can be protected as well. So in a sense, we're now doing equity vaccinations, hopefully, for Arlington County.
And I would just echo, just never assume that they don't care. Sometimes people just need some ways that they can operationalize or practical examples of how to engage in an issue that may not impact them. So I think sometimes we have to trust people, have good hearts, and really just need some concrete ways to help.
And there is a lot of data that exists in other communities where they have looked at the return on investment in addressing health equity issues. In communities where there are significant disparities, it has an impact on tax revenues that come in, et cetera, et cetera, et cetera. And so for some people, we may need to be making the business case. I think we need to appeal both to the heart and to the mind and to the pocketbook.
Absolutely.
Very well done.
Thank you, and thank you for your questions. We've been joined today by some of our elected officials who I think are still here. I saw Matt DiFronti from the county board. Thank you. Tanya Talento from the school board. And to close us out this afternoon, we have Christian Dorsey, who has been focusing his time as county board chair on equity. So, Christian, thank you very much.
Thank you, Abby, and I will be brief. One of the things that is true, that it is part of my tenure as chair, is to surface this idea of equity in the county government as a priority for me, but I want you to rest assured I intend this not to just simply be a one-year initiative that is coterminous with my time as chair, but really to be a new way of thinking as county government as to how we can do our mission and deliver our programs and services better for the foreseeable future. And I'd like to just, even though I wasn't able to be here for the entire conversation, and I'm sorry for that, I am a little bit familiar with the content, so I don't think I missed anything substantively, but the importance of this work, I just can't really overstate how critical this is for Arlington as we seek to move to the next level. As elected officials, we are frequently inclined to want to hear good news. Or through public processes, if we can't get the good news, we want it to deliver a very clear determinant of what we need to do next. And this process, this Destination 2027 process, was neither of those things. The news wasn't entirely good, nor did it necessarily deliver us the dispositive answers for what we need to do next. There is a messiness with uncovering disparities that exist principally when it comes to something as fundamental as someone's well-being. And it also delivered with us a whole host of questions and other areas of inquiry to figure out what exactly is going on. Those are not necessarily comfortable places to be, but they are absolutely necessary. Government has to actually orient itself towards making sure we take the resources that we're entrusted with to doing the public good. And if we think about what that means doing not just good things or beneficial things for a certain segment or for a powerful segment or for a geographically important segment. It means for everyone. And if we think about everyone, you can't just simply look at overall data without disaggregating it to find out what's actually happening to people as they live their lives. So this health work is incredibly important, but I intend for this to be the norm to which we apply all of government's actions, policies, and services. And when we think about applying that equity lens, it means a couple of fundamental things. And to speak to one of the questions earlier, what does someone who's better off have to gain from this exploration of trying to make sure we're not just focused on broad equality, but individual equity? Well, I think what everybody has to gain is a fundamental recognition that A, my resources that I'm committing to government are actually performing the maximum good. Everyone should have that as a fundamental self-interest. But two, the inquiry of discovering how government actions and policies and investments can affect disparities and affect outcomes, it's important to know the answer to that question so you can be an effective civic engager in your community to know what to support, what to oppose, what to advocate for, because if you don't know how government impacts people's lives, then you're really kind of twisting in the wind to figure out whether or not government is being effective. So quite frankly, I think this equity work is not simply about dealing with disparities and orienting government towards not perpetuating inequities and to no longer creating marginalized populations. It's to actually get government to perform to a higher level, which is in everyone's interest, regardless of where you fall on a particular issue. So I'd just like to thank everyone involved with this effort for the work of bringing up uncomfortable truths and further areas of work, even though that's something, we can't check off the box and say mission accomplished. I think it's absolutely necessary for us to be the kind of community that we all intend Arlington to be and we all hope Arlington to be. So thank you all for being interested in it, and thank you for giving me an opportunity to just say a few words at the end. Thank you.
Thank you. Okay. I'd also like to recognize George Barker, Senator Barker. Thank you very much for being here. Appreciate you crossing over here into Arlington. That was kind of you. And Christian, thank you so much for your leadership and for your comments. And as Ruben said before, there's a role for each of us to play. Whether you're working with a PTA or a youth group or a church group, in your office, whatever you are doing in your life and your work, to ask those questions. Who benefits? Who's burdened? Who's missing? And how do you know? If you do that in your lives, we're applying equity to everything that we do, and that's how this is going to infuse through the community. The government work is key, and we are advocating in Destination 2027 for a policy and an entity on that, but it's work that we all have to be doing. So I want to thank everybody, and I want to give the last word to Anita Friedman.
Thank you, everyone. And to piggyback on Abby's remarks, the Destination 2027 report clearly lays out questions to ask in any setting, in your personal life, as you're going to buy your Starbucks. Who benefits from this Starbucks? Who's burdened? How do we know? If we want to be informed citizens, let's ask these questions. It's not going to be comfortable, but growth depends, personal growth, as you know, depends on asking important questions, and community growth depends on asking these questions. So let's take this as a call to action, to get out there, not wait for a presentation coming to your organization. Go ahead and be brave and lead it yourself. And thank you for coming.